1. The milk of the poppy, the enduring power of opium. 2. The original aspirin, chewing on willow bark. 3. The soporific sponge, mandrake, hemlock, and surgical cocktails. 4. Bite the bullet, alcohol, brute force, and speed. 5. Letting the badness out, bloodletting and humoral theory. 6. Fighting pain with pain, cauterization and counter-irritation. 7. A hole in the head, the ancient mystery of trepanation. 8. The divine cause, prayer, magic, and exorcism. 9. The power of ice and snow, ancient cryotherapy. 10. The trance state, hypnosis and mind-body anesthesia. Conclusion. Further reading. Imagine the throb of a severe toothache, the searing jolt of a broken bone, or the sharp slice of an infected appendix. Now imagine all of it without a single aspirin, ibuprofen, or bottle of anesthetic. For the vast majority of human history, pain wasn't just an occasional inconvenience. It was a constant, terrifying, and often life-defining companion. We live in a medical golden age, protected by a pharmacological arsenal that can numb, dull, or completely erase physical suffering. But our ancestors were not so lucky. They had to face childbirth, warfare, disease, and surgery with nothing but their own wits, desperation, and the resources of the natural world. The history of pain relief is a fascinating and often horrifying story of human ingenuity. It's a journey of trial and error, where brilliant discoveries like the properties of the poppy existed right alongside treatments based on pure fantasy, like balancing your humors. Let's explore the 10 most significant ways we treated pain before modern medicine became our shield. 1. The milk of the poppy, the enduring power of opium. Long before it was the source of morphine and heroin, the opium poppy was the undisputed king of painkillers. This wasn't a minor herbal remedy. This was the most powerful ancient analgesic known to humankind, used for at least 5,000 years by Sumerians, Egyptians, Greeks, and Romans. The milk of the poppy, the raw gummy latex scraped from the unripe seed pod, was a potent drug. The ancient physician Hippocrates, the father of medicine, praised its analgesic and sleep-inducing soporific properties. It wasn't that opium cured the underlying problem, it just made you not care about the pain. In later centuries, this took the form of laudanum, a tincture of opium dissolved in alcohol. It became the cure-all of the 18th and 19th centuries, given for everything from teething and coughs to cancer and battlefield wounds. It worked too well, of course, creating a silent epidemic of addiction. But in a world without other options, opium offered a temporary, divine-feeling escape from unbearable agony. 2. The original aspirin, chewing on willow bark. If opium was the heavy artillery for severe pain, willow bark was the everyday workhorse. For millennia, healers on nearly every continent knew that chewing the bark of the willow tree or drinking its tea could reduce fevers, aches, and swelling. The ancient Egyptians used it. Hippocrates recommended it for the pain of childbirth. Native American tribes had an extensive pharmacopoeia that featured willow bark for all kinds of inflammatory pain. They didn't know why it worked, only that it did. They were in effect prescribing nature's aspirin. The active ingredient in willow bark is salicin, which the body converts into salicylic acid. In the 19th century, chemists at the Bayer Company synthesized this compound, buffered it to make it easier on the stomach, and created acetyl salicylic acid, what we now call aspirin. This is the clearest example of an herbal remedy for pain being scientifically validated and transformed into one of the most successful drugs in modern history. 3. The soporific sponge, mandrake, hemlock, and surgical cocktails. How do you perform an amputation in the 13th century? You can't. not unless the patient is unconscious. But how do you achieve that? The answer was the spongia somnifera, or soporific sponge. This was the anesthetic of the Middle Ages, a truly terrifying concoction. A sea sponge would be soaked in a potent, toxic brew of opium, henbane, hemlock, and most famously, mandrake mandragora. The mandrake plant was steeped in myth. Its root was said to resemble a human, and it would supposedly scream when pulled from the earth, killing all who heard it. In reality, it was a powerful narcotic and poison. A surgeon would hold the soaked sponge over the patient's nose and mouth, hoping they would inhale enough fumes to fall into a deep, stuporous state. The line between anesthesia and a fatal overdose was razor thin. It was a chemical club to the head, a desperate gamble to provide a few minutes of stillness for the surgeon's saw. 4. Bite the bullet, alcohol, brute force, and speed. While the soporific sponge was a specialized tool, the most common surgical anesthetic for centuries was far simpler: a large bottle of whiskey or rum. As a powerful depressant, alcohol could dull the senses, and if consumed in large enough quantities, render a patient unconscious or at least semi-coherent. This was the standard practice on naval ships and battlefields. The patient would be told to drink as much as they could, as fast as they could. This is famously where the phrase, "bite the bullet," comes from. With no other way to manage the agony, a soldier would be given a lead bullet to clench between their teeth to prevent them from screaming, choking on, or biting off their own tongue. Because this anesthesia was so unreliable, the real pain treatment was speed. Surgeons like Robert Liston became legends not for their precision, but for their swiftness, able to amputate a leg in under 3 minutes. 5. Letting the badness out, bloodletting and humoral theory. For over 2,000 years, from Hippocrates to the 19th century, the dominant medical theory was that of the 4 humors. This held that the body was filled with 4 liquids: blood, phlegm, black bile, and yellow bile, and that pain and disease were caused by an imbalance. If a patient had a fever, inflammation, or a throbbing headache, the obvious cause was an excess of hot blood. The logical treatment? Remove it. This was bloodletting, the go-to treatment for almost every ailment. This was done by venesection, opening a vein with a lancet, or, more famously, with leeches. A barber surgeon would apply a number of leeches to the affected area. The leeches would draw out the bad blood, and their saliva, which we now know contains an anticoagulant and an anesthetic, might have provided a tiny, temporary sense of relief, further proving the theory. Of course, this practice often weakened the patient severely, but it remained the absolute standard of care for millennia. 6. Fighting pain with pain, cauterization and counter-irritation. Sometimes the ancient solution to pain was to inflict a new, more useful kind of pain. The most brutal example of this was cauterization. After a battlefield amputation, how do you stop the patient from bleeding to death? You would press a red-hot iron or boiling oil directly onto the open, raw stump. The agony is unimaginable. But this procedure sealed the arteries, stopping the bleeding, and unbeknownst to them, the extreme heat also sterilized the wound, dramatically reducing the risk of infection. It was a life-saving treatment that came at the cost of indescribable suffering. A related concept was counter-irritation. This was the idea that the body could be distracted from a deep, chronic pain, like an aching back, by creating a new, sharp, surface-level pain. This was done by cupping using hot cups to create painful suction, or by applying blistering agents to the skin. This theory has a faint echo in modern science. The gate control theory of pain suggests that new sensations can interrupt existing pain signals to the brain. 7. A hole in the head, the ancient mystery of trepanation. This is, without a doubt, the oldest surgical procedure known to man. Trepanation, or trepanning, is the act of drilling, scraping, or cutting a hole through the skull of a living person. Archaeological evidence for this dates back over 7,000 years to the Stone Age. Why would anyone do this? We can only speculate, but there are two main theories. Medical, to treat head wounds, intracranial pressure, or blinding headaches. Releasing the pressure from swelling or a blood clot, a subdural hematoma, could have actually saved a person's life. Spiritual, to release an evil spirit or demon that was believed to be causing madness, epilepsy, or the headaches. The hole was a doorway for the badness to escape. The most shocking part is that we have found many ancient skulls where the bone around the hole shows clear signs of healing. This means the patients often survive this horrifying procedure and live for years afterward. 8. The divine cause: prayer, magic, and exorcism. Before the germ theory of disease, the why of pain was a mystery. For many cultures, the answer was supernatural. Pain was a punishment from an angry god, a test from a deity, or a direct assault by a demon, witch, or restless spirit. Therefore, the cure was not medicine, but ritual. This was the domain of the priest, shaman, or healer. The supernatural treatment of pain involved reciting incantations, performing magical rites, or creating talismans and amulets to ward off the evil forces. If the pain was internal and severe, like madness or epilepsy, it was often seen as demonic possession. The treatment was exorcism, a ritual designed to forcibly cast the entity out of the person's body. In this worldview, the shaman's rattle or the priest's prayer was a more powerful analgesic than any herb. 9. The power of ice in snow, ancient cryotherapy. Not all pre-modern treatments were brutal or bizarre. Some were just as sensible today as they were 3,000 years ago. The use of cold to numb pain is one of the oldest and most intuitive forms of pain relief. The history of pain relief is full of references to cold. The ancient Egyptians, in the Edwin Smith Papyrus, circa 1600 BCE, discuss using cold to treat inflammation. The Greek physician Hippocrates wrote extensively about using ice, snow, and cold water to reduce swelling and numb the pain of injuries. Roman surgeons would often pack a wounded area with snow before and after a procedure. This is a form of ancient cryotherapy that works for simple, physical reasons. The cold numbs nerve endings, literally stopping the pain signal. It also causes blood vessels to constrict, which reduces inflammation and swelling. This is the ice in the rice. Rest, ice, compression, elevation method, a timeless piece of medical wisdom. 10. The trance state, hypnosis and mind-body anesthesia. As we approach the modern era, we find one of the most fascinating pre-anesthetic techniques, hypnosis. In the late 18th century, Franz Mesmer proposed his theory of animal magnetism, a cosmic fluid that he could manipulate to heal. While this was dismissed as quackery, it led to the discovery of mesmerism, or hypnosis. In the 1840s, just before the discovery of ether, a Scottish surgeon in India named James Esdale was desperate. He began using hypnotic trances to operate on his patients. The results were miraculous. He performed hundreds of major surgeries, including leg amputations and the removal of massive tumors on patients who were fully in a trance. They reported feeling no pain at all. This was the first large-scale, systematic use of mind-body anesthesia. It proved that the perception of pain, the brain's interpretation of a signal, could be controlled, though it was quickly overshadowed by the easier and more reliable method of chemical anesthesia, like ether and chloroform. It was a profound discovery about the power of the human mind. Conclusion. The history of pain relief is a humbling and often gruesome story. It's a mirror of our own evolution, a journey from magical incantations to chemical compounds, from brutalizing the body with fire and blades to gently convincing the mind to let go of its suffering. Our ancestors were tough, resilient, and relentlessly experimental. They chewed on bark, prayed to gods, drilled holes in their heads, and drank liquid poison, all in a desperate quest to escape the agony that defines so much of the human condition. The next time you take a simple pill for a headache, take a moment to be grateful. You are swallowing the result of 10,000 years of trial and error. Further reading. For those who want to dive deeper into the fascinating and grisly history of medicine and pain, The Story of Pain, From Prayer to Painkillers by Joanna Burke. The Butchering Art, Joseph Lister's Quest to Transform the Grisly World of Victorian Medicine by Lindsay Fitzharris. Pain,